Presenting a new series, Medically Verbal, where we'll solve case history in just a couple of minutes. Disclaimer: these case studies are for understanding purposes. Inaccuracies may be present. Do not attempt these processes without the guidance of a licensed medical professional. Today we're going to dive into an intriguing medical case. Imagine a 45-year-old man coming to you with persistent headaches and some visual disturbances. Sounds complex, right? Let's break it down. So, our patient has been experiencing headaches for the past 3 months. These headaches are dull and constant and mainly in the frontal region. They are worse in the morning and get a bit better as the day goes on. He also mentions seeing double or blurred visions occasionally. Interestingly, there is no history of trauma, fever, or recent infections. He just feels these persistent, annoying headaches every day. He has hypertension, which is managed with amlodipine, but no history of migraines or similar headaches. He smokes 1 pack of cigarette a day, drinks alcohol socially, and works as an accountant. He doesn't use recreational drugs. His father had a stroke at 60 and his mother has type 2 diabetes. On examination, his blood pressure is quite high at 150 systolic, 95 diastolic. We find an interesting finding in his neurological examination: bilateral papilledema, which is basically swelling of the optic disc. This is a red flag for increased intracranial pressure. There are no other focal neurological deficits. His heart sounds normal and his lungs are clear. So what could be causing these symptoms? Here are a few possibilities: intracranial mass lesion, idiopathic intracranial hypertension, cerebral venous sinus thrombosis, hypertensive encephalopathy, migraine, which is very less likely. Given this presentation, let's consider the most likely diagnosis and the steps we should take next. Intracranial mass lesion. The combination of headaches, especially worse in morning, and papilledema suggests an hypertensive encephalopathy also presents with similar symptoms, and papilledema is less common. Talking about idiopathic intracranial hypertension, it is less likely in middle-aged men. It is more common in smokers. So what are the further investigations which we'll do? We'll first perform the MRI of the brain with a contrast. This helps identifying any mass lesions or structural abnormalities. We'll perform an MR venography, which is magnetic resonance venography, so that we could check out cerebral venous sinus thrombosis. How exactly? It works on the same principle as MRI does, but here we use intravenous dyes for our veins so that we could check out for clots, and that would help us identify the thrombosis. For visual field testing, we'll perform the regular Snell's test and the Jagger's test so that we could check out the defects which have occurred due to increased intracranial pressure. Perform a lumbar puncture. Now we know that there is an increased intracranial pressure. So to relieve the excess pressure, this puncture would be performed. The opening pressure management would be done to evaluate for elevated intracranial pressure. Now this is something which is done only when the imaging rules out a mass defect. We'll also perform a CSF analysis by and by so that we could rule out infections or any other inflammatory cause. Laboratory test, the basic package, CBC, so as to check for infection or inflammation. We'll also check the electrolytes, blood, urine, nitrogen, creatinine, so that we could assess the kidney functions and electrolyte imbalances. We'll perform the liver function test so that we could check for the liver congestion, which is secondary to heart failure. Because we want to rule out thrombosis here as well, so we would perform a coagulation profile test so that we could check out for any clotting abnormalities that might suggest venous sinus thrombosis. For management, would definitely Hope you like the case study of today. You can come back whenever you want to sum it up. Please make sure that this is not a substitute of medical advice and is just for understanding purposes of how to diagnose and solve cases. Thanks for watching.
It could include chemotherapy or radiation therapy.
Directions or suggestions, comment down below. Make sure to like, share, subscribe, and hit the bell icon to never miss another update.